What's the national C-section rate today, the total C-section rate?
Well, it's somewhere around 29%.
Yeah, the last figures were for 2004 when it was exactly right, 29.1%.
Okay.
And the primary cesarean section rate nationwide, primary meaning the first time a woman has a C-section, is around 20%.
19 to 20.
So it's gone up astronomically in the last 35 years. And we can talk about some of those reasons, but first, why don't we look a little bit about the hospital that you work at. Your head nurse, what is her name?
Susan Knotts.
Susan Knotts is going to talk a little bit about the practice at your local hospital in Marietta, Ohio.
Okay.
I don't believe, and that's part of the reason why I believe they should have choices, that there's one better way to have a baby than another. It's up to the woman what is safe medically and what is right for her and what she feels good about in the end. So I try very hard not to use the term natural or unnatural, because all babies are natural. They're not unnatural. A birth is not unnatural. So whether a woman delivers vaginally and has no medicine, or whether she delivers by a C-section, that's still a natural birth to me. Definitely seen a difference in induction rates in this country, and I believe that's driven by our society's planning and scheduling, and women want to, they want to know what day they're going to have their baby on. They want to know if their husband's going to be out of town, then I'm going to be able to have my baby on this day. It's culturally driven by our expectation as a society. Personally, my personal opinion is I don't know that that's a good thing for women, for babies. When someone's induced, it tends to be a longer process. Certainly, the perception is it's more uncomfortable, because many of the things that women do normally in labor at home, and they might not even realize they're in labor, when we bring them into the hospital and we start their labor, then they're here, they get bored, they're at the hospital, they think it's time to have a baby, they get kind of impatient. So those are some, and scientifically it's not shown that inductions increase C-sections in women that have had more than one baby and that are already ready to be induced. But that's not necessarily the case in our society. We don't always, rarely do we induce women who are already ready to be in labor and who have had more than one baby. The studies that have been done have been on, and that's just something that I'm concerned about, because patients will come in and tell us, well, there was a study that said there's no more chance of a C-section if I'm induced. That study compared women who had more than one baby, multiparous, and were ready to be induced. It did not compare women who it was their first baby and they weren't the least bit ready to deliver. So there's a completely different thing. And I think if you're going to make those comparisons, they need to be appropriate comparisons.
You have a very smart nurse.
Thank you.
She made the point that obstetric practice is driven a lot by culture, and it's driven a lot by cultural change. And we live in a very, very busy society today. Women especially are enormously busy. They have many full-time jobs. They're full-time workers. They're full-time mothers. And people like to have their life scheduled. It's almost a necessity. Is that one of the things that is just driving? She described women want to be induced. Right. Even if they're not ready, they want to be induced. If they're not ready, this is one of the contributions to the higher C-section rate. So how much do you see culture and women's desires driving the way you doctors practice medicine?
Well, I think it's everything. I mean, my community is very different than Dr. Showalter's, and a lot of my patients, it doesn't matter if it's their first baby or not, they would like induced, because it's when their husband is flying in from Iraq, and that's when they want induced. Or I have women that they want a primary C-section. They've never had a baby before. This is their first baby, and they say, I just want you to do a cesarean section. And it's when you're dealing with patient demands in medicine, more and more these days is patient driven, and it's we're much more attuned to customer service in medicine, and we're really trying to serve our patients. We want to do what's medically best, but if a patient has a good point and has done research on their own and they've decided they want a C-section, or if they want induced and it's their first baby, then it's sometimes hard to argue against them.
This is a very emotional topic, even among doctors, the whole concept of elective C-sections. I've read some of the transcripts of the arguments at the American College of Obstetricians and Gynecologists meetings, where doctors are literally almost screaming at each other about it. And some doctors will say, if a mother raises the point, can I have an elective C-section? I've heard doctors say, not in my practice. And yet, as you point out, it's also very, very difficult. You lose patients if you say, is that true? Would you lose patients if you refuse to do?
They do. I mean, that not at all does that influence the way we practice. I mean, as far as if a patient threatens to leave or not, we want to do what we think is right medically, but it does. Patients do demand certain things, and I either try to talk them out of it or else they'll have to go to another physician.
Yeah. One of the points that was made at one of our conferences is birth is a normal physiologic process that does not need to be treated. Therefore, a physician should not feel obligated to do a primary C-section just because a patient requests it. She is not in a situation that needs to be treated. And there have been some recent studies that were published that show higher rates of mortality, mothers dying, with normal C-sections versus normal vaginal deliveries. So if you take out the patients who had medical complications, thank God we have C-sections when there is a significant complication that makes it safer for mom and baby.
It absolutely
to deliver
can be
that.
life-saving.
Absolutely, absolutely. And right now the death rate with delivery is less than 1 in 10,000.
Of mothers.
Of mothers.
Fewer than 1 in 10,000 mothers in the U.S. die in childbirth, as opposed to almost 500 in 10,000 200 years ago. So
exactly. So we have made great strides there. And also with babies. What does labor do for a baby? I went to an osteopathic medical school, and we are trained to understand that the body has its own internal wisdom. There is a reason that labor helps a baby get ready to be born. And we've known for a long time that the stimulation of contractions, even if a delivery ends up in C-section, a baby that's undergone labor will do better after delivery than a baby who hasn't. So what kind of things are happening to the baby's brain, central nervous system, during that process of labor that would be impossible to measure? So if we just say, well, it's as safe as because we're looking at one thing, we really have lost the big picture.
Yeah, the maternal hormones that occur during natural labor can also help the baby's lungs mature during labor. And when the baby's going through the birth canal, a lot of the amniotic fluid is squeezed out. There are all kinds of reasons why a trial of labor is important and really helps a baby prepare. Let me ask you this. We talked a little bit about the rise in C-sections, which began to occur in around 1965, 1970. When electronic fetal monitors were first introduced, which a lot of people point to as one of the reasons for the most precipitous rise was between 1965 and 1975. Talk a little bit about electronic fetal monitors and how they might have contributed to the higher C-section rate that we have today.
Well, interestingly enough, I had my first baby in 1977 when the C-section rate had suddenly doubled from 5% to 10%. And everybody was afraid to go to the hospital because of this high C-section rate. Now, we'd all be very happy to have that 10% now. But the reason given was the fetal monitors. We didn't have very much experience reading them. So when there was a questionable strip, the answer became, well, let's do a C-section, make sure the baby's okay. So a lot of babies were sectioned for fetal distress that were not in distress at all. We just didn't understand that monitor. And as monitors became standard of care, then a physician in court is not judged by medical literature, because the medical literature has said routine monitoring is not helpful to give you better outcomes in a normal delivery.
Even the American College of Obstetricians and Gynecologists has said that year after year after year to the present day.
But that does not affect practice patterns, because in court we're judged by what the doctor down the street is doing, not by what the medical literature says. And so physicians are afraid not to use the monitors even when they have a very normal situation.